Welcome everyone to SDP Connect. My name is Christiana Morales. I am the director here at Disability Voices United for Self-Determination Program. Um, we have a great presentation for you today, but beforehand, I want to make sure that everyone knows that we have interpretation in English, Spanish, and Korean. So please go down to the globe at the bottom of your screen and select your language. Even if you speak English, make sure to select English because if a question is interpreted, you won't hear it. If you're on a cell phone, go to the bottom of your cell phone and you'll find three dots and select the three dots, and that will give you your options for languages. So I think that a lot of us were in the master plan meeting today. So a lot of people might be a little frazzled or tired if you were in there. So it seemed like about 300 hours, but it was, I think, 2.5, 3 hours. And it just finished about 4 o'clock. I have a couple announcements before we get started. The first, I'm going to share my screen. The first one is that in partnership with the RCOC Regional Center of Orange County, Disability Voices United is doing a 3-part person-centered plan training in Spanish. And the second part will be on May 18th. If you've been going to that, we did move the time up just for this one because we heard from a bunch of people that there was a conflict. There was something a lot of them needed to be at 11 o'clock. So we moved the time up. So do be aware if you are attending or you want to attend, it's from 9 to 10:30 on May 18th. The registration link is the same if you were going. Also, there is Spanish to English interpretation, so if you are interested in going, please feel free to go. The second announcement we have is in partnership with Inland Regional Center. We are hosting a conference resource fair and micro enterprise market, and that is on June 8th from 9 to 2. This is only for Inland Regional Center clients. So unfortunately, if you're not part of Inland, you can ignore this part. Don't listen right now. But we would love to have you come. The registration is open, and we will put the link to the flyer in the chat so you can register. We have it in both English and in Spanish. So if you want to go, when you go for this one, you will get a copy of the Think Outside the Box book and lunch. So come and visit us. I think it's going to be very fun. We're going to be talking there's going to be two panels that are going to talk, and the first one is going to be talking about life in self-determination and their experiences. And the second panel is going to be talking about things that you should know when you're in the program. And so we're going to have experts talking about the things that you will want to know in self-determination. For that same resource fair, we will be having exhibitors. So this is the exhibitor sign up. So if you provide services in the Inland Empire, please join here. You can sign up here to become an exhibitor, and we would love to see you exhibit. For the micro enterprise market, we're so excited. We have so many great people who are going to be sharing amazing things. We've got everything from artwork to somebody who does they 3D print cookie cutters, which I thought that was such a cool thing. We've got people who do chocolates, like chocolate lollipops. We've got people who knit beautiful things. So there's all kinds of things that are going to be there. So plan on coming by the market and visiting with everybody there. And we also have that flyer in Spanish as well. And those flyers will also go into the chat. So I'm going to stop sharing now. And now I get the great excitement of introducing, we have new FMSs in town. And so at Disability Voices United, we do not endorse anybody. So we're just saying this up front. We're not endorsing anyone, but we definitely wanted you to know, to meet the new FMSs in town. And so they are here to talk to you today. So we have Eric, did our third speaker show up? See if I hear from them. I don't know if our third speaker showed up, so we're going to go ahead, and if she shows up, then she can jump in. That'll be fine. But to begin with, I have Mark Altieri from Public Partnerships. Give us a wave, Mark. And I have Peyman Dadmehr. I butchered it, didn't it? Say
No,
your last name.
it's Dadmehr. You
Yeah,
got it.
see, I knew I was gonna mess it up, but I even asked you beforehand.
Close enough.
And payment is with ACE FMS. So, thank you both so much for being here. Um,
For having us.
so FMSs are the key to self-determination, right? And so the partnership of the participants with the FMS is so key to having a smooth running program. So we really appreciate you coming to share information about your FMSs and who you work with. So I have questions for you, but I thought you might want to start by introducing yourselves and a little bit about your FMS to begin with. Mark, do you want to go first?
Sure. My name is Mark Altieri. I work for PPL. We are an FMS that has been in business for 25 years now, and I have been with the company for 17 of those. FMS is all our company does for the last 25 years. We are a national FMS, but we've been in California since 2012 with the Golden Gate Regional Center. And I know, and we'll talk more, but I know Californians and SDP think that it's totally unique program, or a lot of folks do. And it is unique and beautiful in so many ways, but it's not so different from a lot of other models and state agencies that run models for folks with developmental disabilities. So I think we can take a lot of what we've learned through GGRC and from around the block nationally and apply it here. And we'll talk more this afternoon. So I will pass it off to Payman.
Thank you, Mark. It's hard to follow your lead. Compared to Mark, I've been doing this for 25 minutes. So we're a brand new FMS. I went through the SDP process with my daughter less than a year ago. And I experienced some of the frustrations that a lot of the other families have going through the process of making that transition. And I so much so that I got inspired to start my own FMS company. So I'm one of the principals at ACE. And I think we bring more of a parent perspective from a consumer standpoint. And we try to come up with solutions that make our lives a little bit easier. And we try to simplify things as much as we can. So that's kind of our approach. And we're learning and growing with the families we've started to support. And I'm very humbled to have the opportunity to learn from everyone else who's been doing it for decades longer than I have. So I'm very honored to be here.
So the first question I think on everybody's mind is, what regional centers do you offer your services to?
We're at San Diego right now to start, and we are trying to not bite off more than we can chew, because I know that has been a path that some of, particularly the national FMSs, have taken. And so our plan is to expand to 5 more this summer, and that would be Inland, Alta, West Side, San Gabriel, Pomona, and North LA. And once we're running a good restaurant, as they say, in those places, then you continue to expand, but you don't want to expand your business too quick. Definitely not as an FMS for SDP from what I've observed.
And then the best way for them to find out is just to ask their service coordinator, are you with us now yet? Or
Well, I mean, we're quite active on social media. I don't want to start plugging different sites in this chat, but we have our own Facebook page dedicated to SDP. We keep a very active website which, you know, if it's permissible, I can put a couple things in the chat here, but I don't want to be obnoxious and start plugging all types of URLs and phone numbers. But we'll definitely we also do Zoom meetings a few times a week now definitely for independent facilitators and soon to be other groups. So we will keep the SDP community plenty abreast of our expansion plans for sure.
Oh, that's wonderful. And if you feel free to put anything in the chat.
Okay.
We'd love to
Okay.
share any info
Okay.
you have, put it in there. Um,
Okay.
we did have a question. If you could maybe after your name, put the name of your FMS, because we did have a couple of
Sure.
people
Yeah.
ask. Um, and Payman, what regional centers is ACE working with?
So we work with essentially all of them except for Orange County. We also didn't want to get overwhelmed, so we left Orange County out. So we figured that we can handle 20, but not 21. So,
That's just over the top.
yeah, actually, to be very honest, their paperwork was more than the other ones. So we kind of deprioritized it. But Orange County is one of the ones, being local to LA, that obviously we're going to add them. We just haven't gotten around to it yet.
Awesome. And so you're currently open to all 20.
Currently open to all 20. We don't currently have clients in all 20. Some of the regional centers are not very active in the STP. But we're excited to be one of the few options because when you go outside of the more populated areas, the options become very limited, especially for a particular model. So sometimes I'll talk to a client and they're looking for co-employer, for example, and we're literally one of only two options for them to choose from based on the regional center they're with. So we're excited to make that option available to the clients.
So Payman brought up a great point, which is every FMS doesn't work with every regional center. So we will put in the chat the link to the DDS site so you can look at your regional center to see which FMSs work with yours. So we'll make sure to get that into the chat. So our next question is, because Payman brought it up, what models do you offer?
The Peyman, we'll switch off here. Peyman, you could go first.
Sounds good. Mine is really easy. We do all three. So we do co-employer, sole employer, as well as bill payer. And based on the budget sizes, not all the models are the right fit for the families. So we try to guide them to make the right selection for them.
We are currently doing bill payer and sole employer.
Sorry, I was typing at the same time as I'm listening. Perfect. Everybody's going to ask this. Do you have a waiting list? Because I think everybody has that on their mind right now. And if you don't, what is your enrollment process?
So we don't have a waiting list right now, and you know, we're just at San Diego, but we do not have a waiting list. On the enrollment process, I'm going to give maybe a 2-minute answer. Sorry, folks. In other programs around the country, there is a role called a support broker. And a support broker is common in self-determined models for developmentally disabled folks to approach everything from answering that individual's very first question to sticking with them through the enrollment process, explaining roles, responsibilities of what it means to be an employer of record if you're in sole employer, or what it means to self-direct your services in a co-employer model. And you bring really like a case management type mentality, meaning you get an assigned support broker and they're with you throughout your whole time self-directing, provided they stay at the same company. And so you have this fantastic role of independent facilitators, and then you have the FMSs that can have a customer service line, which we do, but our customer service folks are going to generally be there to handle calls from people that are checking us out as an FMS, or maybe have an easy question like, how do I load an EBV app onto my phone? Could you tell me real quick? But any issue that may arise that pertains to your enrollment, payroll to a worker, payroll to an agency, purchase of a good and service, and it's not going proper, you're going to deal with a PPL support broker. So the journey would be Christiana calls in the public partnerships and has a conversation because she's just checking us out. And she decides based on that conversation with the customer service staff, I like you guys. I want to use you as an FMS. All right, we're going to assign you a support broker, and they're going to call same day, next day. And from there on in, the support broker is going to get as close to that circle of support as we're allowed to get. And so what we'd like to do is be on the front end with the family, the independent facilitator, the regional center service coordinator. Let us just be let the support broker be a fly on the wall for the meetings, even if that's all we are. But getting eyes on spending plans, person-centered plans, if we can hop on an IPP meeting, that from our standpoint, this new financial management transition fee is in recognition that you should be offering families a one-on-one, and we're going to term it a PPO support broker, and you're going to get handled from the moment you decide until the very last day that you're self-directing your services to that support broker. And then from an enrollment standpoint, yeah, we have a computer system and we can do it all online. We could Zoom it up with the individual or family and complete forms online. They could be on our system and we could talk them through it. If they want it paper-based, we can print it, we can mail it. Then we could do a Zoom meeting. It's pretty much Burger King, have it your way when it comes to enrollment. And so that's how we're going to handle it.
Do you require them to have a certified budget and a spending plan before they come to you?
No, and the reason is that transition fee. So I'm just gonna say, I work in 21 states around the country. I've never seen an FMS transition fee introduced by a state agency. I think it's a great idea, and I think it is sufficient funding that the FMS should want to get as far upstream with the family as they can. Because if you look at it in the grand scheme of things, it isn't going to be even 4 meetings. And even if every meeting was an hour, it's 4 hours in the grand scheme. And then in the end, they say, hey, Mark, I talked to Peyman and I talked to Ace FMS. And at the end of the day, we're going to go with them. That's fine. That's fine. Peyman's running a great FMS. But I do think the FMSs need to be embedded in the SDP community. And that means upstream, even at the expense of having some families not pick you at the end. I think will be helpful. I know our staff will be helpful.
Wonderful. And one of the things we do talk a lot about here at Connect is to interview the FMSs and find the one that's going to work right for your family, and for you. Payman, do you have a waiting list and do you have an enrollment process?
We don't have a waiting list. It'd be kind of obnoxious to come here and get everybody excited and say, by the way, you can't have us because we have a waiting list. So we don't yet. One of the reasons we started this company was to avoid this kind of wait list scenario that a lot of families deal with. With the volume that we're getting, I may at some point come back and say we need to kind of have a wait list or something. So don't anybody hold me to that. But for as long as we possibly can, we're going to try to keep it available and accessible as quickly as possible. In terms of the onboarding process, it really starts with an initial consultation. We generally do it on Zoom, and we spend as much time as necessary with the clients, prospective clients, to answer any questions they have. If they want to take a look at our portal to get a sense of how it works and how we operate, we give them a quick demo. And there have been many times that we were not able to support the client, and it was very clear early on in the conversation because of their budget size, because we are a smaller FMS after all. But we spent 30 minutes talking about the different things they can do and helping them find an FMS that does meet their needs. So as Mark said, this is really about us connecting with the community and helping the community make the right choice for them, even if that right choice is not for them to go forward with us. I think there are two things that really help us maintain that kind of position on this. One is we all entered this business for non-monetary reasons. We're here to make an impact in people's lives. But also there is no shortage of clients. We don't have to fight over taking clients from other FMSs. If we're not the right fit, we would like him to be with the right fit for their needs. In terms of the actual onboarding, they get an intake specialist that's designated to them that will help them with that process. Most everything we do is handled online. It's really as simple as creating an Amazon account. But even so, we set up a Zoom session, we walk them through it, mostly we watch them do it themselves. We answer their questions and guide them through that process. And after they're up and running, then there's multiple support options available to them to help them with that transition and the education that goes along with it.
So then it ties right to the next question, which is, do you have budget limits? Because you kind of mentioned that you had a budget limit. So what is your budget limit?
So we have a budget limit of 120,000. But I'd like to clarify that. 120 just means that anything over that, we're not likely to take. What it doesn't mean is that if it's under 120, we're just going to take any client that is interested in us. We evaluate each client on a case-by-case basis to make sure that we are the right fit and we can support their unique needs. Everyone's needs are different, whether it's a matter of the type of employees they need, if they need skilled nursing or things like that, or it's just a matter of the type of vendors that they have on their spending plan. So we try to be upfront and as transparent as we can with the families and make every effort to accommodate as many as we can.
Mark, do you have a budget limit? I forgot what my question was there for a second.
Right. So, we don't, and I'm gonna again just talk a little bit from the national and the historic self-determined perspective here. Uh, Once upon a time in FMS reimbursement, I'm talking back in the early 2000s, the way state administrations would oftentimes handle the FMS reimbursement rate, it's called a per member per month in most other states. And the way they would handle that was the FMS got a percentage of the budget. And that was in place to recognize that if you take a $250,000 budget as an FMS, then the amount of cash that you're advancing and waiting to get paid back is a bigger burden on the FMS. It starts to add up. And so as a percentage, you would get a higher per member per month. Now, California is trust me, folks, the very rare state that has a tiered per member per month. Now, it's not directly tied to the budget amount. It's tied, as you guys know, to the number of workers and providers on the plan. Probably more often than not, that's a good proxy for budget size. And so in any other state that PPL is contracted in, you get one per member per month, period. And you take everyone. And so we have people in our Pennsylvania program with $500,000 budgets, and the per member per month is $85 a month. And that's what it is.
Wow.
And so I sincerely appreciate the Californian mentality on this tiered FMS structure. Uh, I will say, and I think Peyman would agree, and probably a lot of you on the phone would agree. Do you have $100, Mark? I have it as long as I'm gonna see it again, type thing. So what I've heard is that different regional centers pay timely to different degrees. And so it's one thing to take a big budget and get your money back 2 weeks later. It's a different thing to take a big budget and see your money again 6 to 8 weeks later. And so I'm gonna go with payment on this one and say we have to talk to the family. We also have to keep the regional center, I hate to say, in context. Some have better reputations than others. And we're not talking about, just so everyone knows, I mean, ACE FMS and PPL FMS. Our revenue is the administrative, the per member per month fees, the DDS pays. That's our company's revenue. We're not making a dime on the service payments. All the payments to the workers, the providers, and all the goods and services, that's just what's called pass-through service funding. And if Payman lays it out or I lay it out, and we lay out $25,000 a month and we only get 23,500 back, if you do that too many times, you'll be out of business as an FMS. And so we are fortunate to be a large FMS, and we do have the financial capacity to take big budgets. Now, I don't know what your definition of big is. I've heard there's $1 million budgets. I've heard there's $750,000 budgets. I'll admit those might be a little too high, but is we're not going to put a cap on it. But to Payman's point, everybody's coming in with an individual story. And so I did talk to a family the other day, $186,000 budget, 11 plus providers. We're going to talk to that family and try to enroll them. And they're at San Diego, and San Diego's been paying very timely on their service claims. If that same family came to another regional center that had a reputation of not paying for 4 to 6 weeks, it's too much, folks. It's just too much and too long a wait.
Well, I'll tell you that it's a concern we have is that making sure that all the budgets and I can absolutely understand where you're coming from, and we hope that you both get to the point where you can take every size budget and that you're working towards that. Um, so other common question, what is your employer burden and what does it include?
Mark, you want to go first?
Yeah, I'll go. I have it memorized at this point. It's 18.74% for sole employer. And if you want it broken down, I can. I'll try to do it in 2 minutes. And I see like a ton of questions flying through the chat too. And I worry that I'm not always clear in what I'm saying, because I see a question about what is the PPL FMS cut as a percentage on a $500,000 budget, 20-30%. There is no cut. I did not mean to maybe confuse the issue by talking about a percentage of budgets. That's not how SDP works. So on employer burden, I'll try to say something over a minute and a half, and hopefully I don't confuse more than I enlighten. Our 18.74% is made up of the following. FICA contribution, also known as your Medicare and your Social Security contribution. Anyone that's had a job in their life, that's gotten a check and had taxes withheld, had Medicare and Social Security taken out of it, trust me. And if you're an employer, you have to match that contribution of your employee at 7.65%. No more, no less. Then you have, if you've ever known anyone on the calls, ever known someone who's gone unemployed and gets an unemployment check. The dollars that are behind that check are federal dollars and state dollars. So every employer in the United States should be paying into the federal unemployment tax pool, of which California's federally mandated rate is 1.2%. And then you have to pay into the state unemployment tax pool of California. And for a new employer, California sets that at 3.4%. Then California has a really pool tax. It's only 0.1%, but it's your training tax. And you guys take that money and you train workforces that are desperately needed in California. I actually think it's a great idea. And then you have accrued sick leave, which from everything we can research should be held at 3.33%. And again, I think that's a great social policy. I don't know any other way to do that other than employer burden. I've never heard of another way to do that. And then the other percentage that we have in the mix is workers' comp policy that we provide. That's at 2.79%. And I'm sure there are companies that could probably negotiate with a broker a lower percentage than that. That was as low as we could get it. And you add those all up, and that's the 18.74%. There's nothing else in there. And I'll be honest with folks, under sole employer, right hand raised, that's the honest to goodness truth of what the employer burden, other than that workers' comp percentage, should be. Additional percentages for processing payments are not permissible by Medicaid. They're not, as an FMS. I'm just letting folks know. So you all should know that.
Peyman, do you want to?
I'm so glad I had Mark go through this one first because he covered everything in great detail, so it makes my job easier. So, what Mark charges 18.47% for, ours does not include workers' comp, and ours is 18.3. So depending on whether or not you need workers' comp, because in some cases the home policy may provide the workers' comp coverage, then it can be that it's 18.3, or it could be that there's another 2, 3, or 4% additional on top of that. That's for the sole employer. For the co-employer, our current burden rate is 25%. And in addition to the sole employer items, it includes the workers' comp, liability insurance, as well as health insurance. And that's a rate that will likely change once we have 1 year of operation and have a better sense of what our exact actual costs are. Part of what we're having to pay for is the premium of not being a company as large as PPL. So the workers' comp rates and the liability rates that larger companies are able to get are not offered to us as a small FMS. And it was an eye-opening experience for me because when I was shopping as a parent, I was outraged when I would hear these 23, 25% rates because I was used to that 17, 18% normal rate that other businesses pay. And then when I started talking to brokers and they started talking about 5, 6, 7, 10% workers' comp rates, then I started to realize why the rates are where they are.
So there was a comment that I thought you would enjoy that said, it was from Beth Martinko at 502. She said, not all FMSs have that skinny and employer burden. Bravo to you guys, and please come to Orange County. I thought you would enjoy that. Don't worry, we will get through the chat questions at the end, and we'll have raised hands, so there'll be lots of times for Q&A. So then our big question we get lots of people ask are, will you make credit card purchases and do you do reimbursement?
I'll take this first.
Go ahead, Peyman.
So we do credit card payments, and this is a question that comes up quite a lot, largely because of I call them the Christmas special directives that DDS put out with the authorization for paying for the pre-purchase of services and all that. So I think it opened up it made it a lot easier for FMSs to support their families. There are a couple things that the DDS didn't do. One is they didn't waive the requirements of vetting these vendors. And a lot of families are under the impression that they can just walk into any vendor and without asking for tax ID or anything, just start using the vendor. That is unfortunately not the case. We still have our job to verify and vet the vendors. The second thing that DDS didn't do is they forgot to give us their credit card number. And a lot of these vendors require credit card numbers. Some require them on file. So we do support it. It's handled in the form of a purchase request, whether it's a purchase of service or goods. The clients would submit it through the portal and we would make the purchase for them. We just rolled out a beta program where we're issuing virtual credit cards to the clients, and we have a few families testing that out. The credit card will have a spending limit of 0. They submit their request. We still do our due diligence of verifying everything we need to do. But when it comes down to the actual payment, rather than our staff calling the vendor and trying to explain who we are, who we're paying for, why we're paying for it, and all that, we'll just increase the credit limit on that card and ask the family to make the payment. That will also enable them to do monthly recurring charges like gym memberships that require having a credit card number on file. So that's the most exciting thing that families seem to appreciate. And it's honestly the only way that we found we can balance our obligations to do our due diligence, but at the same time, make it convenient for the families. Because the two of them kind of become mutually exclusive. It's very difficult to balance the two.
I'm going to start in reverse. And again, I'm speaking on behalf of PPL, and I hope that everything I'm saying is accurate. I do believe the Medicaid, again, when you take this up to the highest level of where funding comes from and where authority was given to California to operate the self-determination program, it's a 1915C Medicaid waiver. And so Medicaid continues to rule as far as policies under self-determination programs. My understanding is that reimbursements are not permissible to the recipient of the Medicaid budget, funding, services. And so it's not really an ACE FMS or a PPL FMS thing that we don't want to reimburse the individual or the family. It's a Medicaid thing. You're not supposed to make direct payments in any way, shape, or form to the Medicaid recipient. So that's why we don't make reimbursements. There are other reasons that I've heard argued that are also good reasons. There is an element of classism in there. If you start doing reimbursements, you have families out there that can't afford to just go out and buy the good and then wait for a reimbursement. That's not really helping everyone. That's not really forcing the FMS to have a policy and a procedure like Peyman just described, where everyone can access a good equally and with equal ease and equal access. And that's really what a program should always be about. And so that's my deal on reimbursements. We don't do them, and I don't think, at least my opinion is, no FMS should be doing them under Medicaid policy. On the credit card, yes, we will make credit card purchases. It is definitely not as easy for an FMS to make credit card purchases as it is for our kids to grab a hold of our iPhones these days and jump on your Amazon account and say, I'll buy that. But there really is no other way to make timely purchases of goods without using credit cards. And Peyman already described some of the nuances of doing them. But if you don't use them, then you're going to have these stories that Peyman and I have heard of families going 3 months without the good in hand. And it's because a game of ping pong starts between how the person's going to get paid. Is it a check? Is it this? Is it that? Just go out and buy the good on a credit card. And then, of course, we have to log all the details into our system for auditing purposes. We have to keep a paper trail. And so it is a little onerous on the FMS's end from an accounting standpoint, because it isn't as simple as just plugging in the credit card numbers, hitting buy, but you have to do it. You just have to do it. So yes, we do it. I don't know another way. We're all used to getting things timely in this day and age. Maybe we've grown too accustomed to getting things very timely, but that's the times we live in. So yes.
I think for what I hear most often where it comes to like social rec, like a karate class or those kind of things, that's where if it gets difficult to pay for things if the FMS isn't willing to use credit cards. So that's why we're always asking to make sure that people can access what's in their spending plan. So then,
Just to say one thing, if you don't
oh,
mind.
sure.
This comes up a lot with our clients. We do every effort, including making these credit cards, to accommodate the clients. But I also explain to clients, I pay about $3,000 a month for my health insurance. Even so, I can't go to any hospital I want. I can't go to any doctor I want. If somebody's not willing to work with my insurance company, I don't get to use them. And as much as we all want to use our favorite karate instructor and art class and all of that, if a vendor is simply not willing to play by the DDS rules, at some point, there's nothing an FMS can do about it. So I think it's something that's important for families to recognize that just because a resource is available in the community, if they're not willing to do, and it's not a lot of work, but if the vendor is just simply unwilling to do that little bit that we do need to do our job as the custodian of these funds, then from an FMS, our hands are tied and we're not able to really do anything about that.
I'll tell you from the DVU standpoint, which is there from a civil rights standpoint, there can be no difference in requiring somebody to pay differently for because you have a disability. So that becomes an issue of you know that. So that's where we stand. I know that with some FMSs in co-employer, are limits on nursing, ability to hire nursing. This doesn't really apply to you, Mark, since you do sole employer. Payman, do you have any limits on who can be hired in? Oh, there you go.
We do, yes. So we can't support nursing care and administration of medication or feeding through a G-tube. It's fine if the client has a G-tube as long as our employee is not required to feed through it. The last one I added is almost for comical relief, but we also can't have facilitators as our employees. We've had families that have requested to the parent of an adult client wants to be a facilitator and they don't want to get a business license or be treated as a vendor. So they've inquired about being an employee, and we just can't have that because it would be a direct conflict of interest to have an independent facilitator who is a FMS employee. So that's something we can't support.
Wow, that's a new one on me. I hadn't heard that one.
It was new for me too, but we're learning.
Interesting. And then for sole employer, though, there's no
Correct.
limits for in either one of yours. You can hire somebody to do nursing care. Okay. How do the participants receive their monthly statements?
So, I know this is a hot button issue. So, monthly statement in a PDF format could be mailed, could be emailed to the individual, and they have to go to the regional centers. And so those will go to regional centers as a bundled PDF. And then we have a web-based system, so you can log in and you can see your spending plan balances by service, and those will be as current as the last payments made, whether it's a provider, a good, or a worker. But it is not, and I understand it's not a substitute for getting your monthly statement sent to you, whatever way you want it. If you want it paper mailed, we'll paper mail it, and if you want it emailed, we'll email it. And then if you want to do both those things, if you want to opt out of those things and just use the web-based system, you can. But I have heard that there's been some substituting of a web-based system for the spending report. No, we'll still send it. It is the same deal as like your credit card statement. I mean, by the time we cut our final payments for the month, we need a couple weeks for everything to process and make sure the numbers, then we send you the statement. And if you've spent anything in between time, it could be a little bit off. And that's why we have the web-based system, plus we'll send you a spending report.
We have the same options available for our clients as well as the regional centers. Most of our clients so far have opted to just go to the website and to the web portal and get the live report. It's a little bit more user-friendly, and they can filter and look at it differently and kind of manipulate it a little bit. The only other thing I would add, and I suspect it may be the same with your system, Mark, we also show what's allocated. So as soon as somebody clocks in, as soon as an invoice comes in and is entered into the system, the funds would be allocated and removed from the available balance. And then once it's actually paid out, it would move from allocated to spent. So at any given point, they can track what's available. I always tell clients the money can move from available to allocated to spent, but those three always add up to what you started with. So every dollar, every penny is accounted for at all times.
That's helpful for if you had something pending and you forgot or whatever, you would see it in there. Um, what is your processing time for invoices? I'm
We
grilling you
run,
guys.
yeah, no. We run the same schedule that we run for employee timesheets. And so I think the question's probably backed by, we've heard horror stories of invoices taking 4, 6, 8 weeks to pay. No, we're gonna process and pay it the next time we make payments, and we're making payments every other week minimally. But once we pick up some volume, we'll probably go to weekly. And we won't pay we'll pay employees on the semi-monthly schedule, but in a lot of our programs, we'll do goods and services type processing weekly, because you're not doing all the taxes that you have to do with the employers and the employees when you run a full payroll. So it's actually not that burdensome.
We also process on the same schedule as our payroll, which is semi-monthly, so essentially almost every 2 weeks.
Mhm.
So 1st through the 15th is paid out on the 25th, and then 16th through the 31st is paid out on the 10th of the following month. On the employee side, that gives enough time for the clients to approve the hours, make any corrections that needs to happen, and then for us to process the payroll. We put the vendors on the same schedule just to avoid confusion and for simplicity for the clients to follow. And we've also toyed with the idea of going to a weekly payment for the vendors once there's enough volume. From an FMS standpoint and cash flow, it would actually be better for us to bill it on a weekly basis. But as you probably know, e-billing is not the most efficient interface to work with. So at the moment, it seems like going through that process twice a month is better than every week. But it is something that will likely make more frequent as time goes on.
For our participants, if you don't know what e-billing is, it's how vendors of regional centers get paid. And it's a very, very archaic old system. I think maybe like the Flintstones might have created it. So it's somewhere in that era. There's, some sort of chiseling with a a, a tool on a stone to get paid. um, so then kind of the next big question is how long is your processing time to onboard a new employee?
Before we answer that one, Tim has politely raised his
Oh, I
hand.
didn't see because he has a yellow background. I'm sorry, Tim.
Hi, Mark. It's been a while. I remember when I was in the process of getting into the program. We had many conversations of my needs, and one of your staff members came to my PCP, and she was very helpful even though I went with someone else. Since this is your second time at providing services in California SDP, how can public partnerships ensure participants will stay around this time? Sorry, I know you and I are friends, but who else do you know is good to ask rough questions?
I could not agree more. So Tim and I go way back, as you all just heard. So PPL came in the year of COVID-19 and tried to start up our FMS services for SDP. And When you're in 20 plus states running self-determination programs, the needs of the states that brought to us as an FMS, and in needs that included, can you guys get $50 million out in Cures Act payments to 15,000 employees 2 weeks from now? Can you guys restructure your system to pay employees more money during COVID? Can you restructure your system to allow parents to provide care for children, even though that's not normally our program rule? We absolutely, please trust, got flooded with so many very, very unusual requests for our staff. And our company went through a lot, like a lot of companies went through a lot during COVID-19. And we just could not do our best work. We were new. We only had 8 to 9 families, and we were not delivering at the level that we all knew we could because we had so many external strains on us. And it was a moment in time, as you all know, and luckily we're all through COVID-19, but we couldn't handle we could barely handle the requests from our 21 states. So Tim's questions, I'm glad he asked it. We have been around 25 years. We are definitely not going anywhere. I think we're all ready for a global pandemic to do better than we did the first time if one happened. But COVID really rocked us as a company. And so we're back. We think we're better than ever. We're sure not going anywhere, global pandemic or not this time around, Tim. Have you not been in 20 some odd states and you had the chaos that ensued with states and Medicaid changing regulations left and right and at making a lot of demands? We wouldn't have left, but we had to start prioritizing what we could support at that juncture, which was a wild juncture. And I'm glad you still consider me a friend, Tim. I appreciate that.
Tim's toughest on his friends. I'll tell you, that's the truth.
Then I'm happy
I
to
got
be
him laughing on that one. So the question was how your process time for onboarding employees.
So I don't know, Payman, I just ran my mouth. You could go ahead.
It sounds, and I'll tell you why, because our process time is 7 days. So from the time we get opportunity, we're generally able to onboard an employee 7 days. The reason I say it's a little bit of a trick question is that we have quite a large number of employees that are invited to join, invited to complete their profile, and they don't necessarily rush to complete it. And I also think, and I take responsibility for this, we've made it a little bit inconvenient for the clients to send the invites out through our portal. So they send the invite out when the employee is not necessarily ready to sign up. We had one that didn't have a valid ID, hasn't had one for months. So I would say, I can confidently say within a week of the employee completing the information that we need, we can have them onboarded, absent some rare circumstance of something coming up in the criminal background requiring a little bit more due diligence. But in most cases, to DDS's credit, within a couple of days, they get back to us on those background checks, and we're able to complete it and move on with the onboarding.
Yeah, so similar, as Payman just said, to some degree, it is employee driven, but that path I described before, where you get an assigned PPL support broker, part of their role is also, do you want me to reach out to the worker and sit and do a Zoom while they log into their profile and do it like that? So we can be very hands-on with the worker as well, even in sole employer. Sole employer, the individual's just learning what it's like to be an employer. I don't expect them to all of a sudden know what a Form I-9 is, and that's a confusing form to look at if you haven't looked at one in quite some time. So I don't think we're all that different from Peyman. They're providing very much hands-on too, but we can be and try to be as hands-on as we want. But if we can't catch that worker, it's going to stretch out to more than 7 days. But that's about right. The paperwork, you can complete it all in a portal like ACE has or PPL has in probably under an hour. Um, but it's a little self-paced, but there are no long time lags, no backups. We didn't touch that paperwork for 10 days after receipt, none of that.
I'll give you some of the feedback from the chat so you'll know it wasn't meant to be a trick question so much as so Mary Nahidi at 524 said, how do you bring on board when the background checks take so much longer? So I think it probably surprised everybody in this room when you said DDS is getting background checks in 2 days. Tina Ewing Wilson at 524 said, yeah, sometimes background checks are taking months.
So I don't know if, and I'm not trying to point fingers at any particular FMS but I can just share my experience. We've never had DDS take more than a few days to get back to us. Now, whether that's an explanation that's just given for delays that are caused by other factors, or if there was some reason that that particular individual's background check took longer, I can't speak to that, but our experience has been fairly positive. There was a period a couple of weeks ago where it was taking maybe more like 4 or 5 days, and they were very apologetic, quickly jumped on it and got it back to that kind of like 2-day turnaround. So in my short experience, it's been a couple of days.
We had another question in there, which was about do you require background checks on everybody in sole employer? So I'm going to give a little background to everybody to clarify what my question is in case they don't know. In co-employer, the FMS is your employer of record, which means they are hiring these employees on behalf of you, and they will determine who gets background checks. And most every FMS that I know that is in co-employer requires everybody to have a background check. In sole employer, it will depend on the FMS. Some of the sole employer FMSs will still require everybody to have background checks, but mostly in sole employer, you can choose as long as that person isn't doing personal care. The law requires anybody doing personal care, and when I say personal care, I mean touching your body or in any way, they would need to have a background check. But if they're not, if it's somebody who's going to pick you up and go to the park with you or do the kind of things, and you don't need any assistance in any other way, the participant could then decide whether they want that background check or not. I'm not discouraging background checks to anybody. I think that if I was personally from my own family going to hire somebody that I did not know anything about, we would run a background check even in sole employer. But if I'm hiring my son's best friend who I've known since he was in diapers, we're pretty certain that we don't need it. So that was what the question was. So in sole employer, do you require background checks?
So yes, we do. And I am going to go national again and say I've never worked in a state with a sole employer model where even if the worker works for Mark and works for Peyman, but there's a difference. It doesn't even matter if there's a difference of a week or two, that worker still needs another background check. And the reason I'd heard early on was if Mark Altieri works at Target and he works at Walmart and he works on the front register at Target and Walmart, it's the same job at both places. Walmart does not care if Mark has a background check done by Target or not. They're going to get a background check on Mark because even in the last week, Mark could have done bad things and Target would want to know. And I do feel like every family that's going to enroll in sole employer and accept that responsibility of being an employer of record, it's worth it. And it's worth it to the second family, so the workers already provide an SDP services for another family, just had a background check 2 weeks ago. Yeah, but if unfortunately, self-determination programs come under a lot of scrutiny nationally for fraud, waste, and abuse. And I think it's unjust. But unfortunately, what I've seen is if you have one story in a state whereby that worker who had a 2-week gap between two different individuals that they work for, and you opt to not do the background check, and one bad thing happens from that worker, you can put a black mark on that self-determination program with a lot of state legislators and policymakers that'll say, see what happens? We don't want that. We don't. You have a wonderful program that's trying to get over the hump and grow and expand. And it's just not the type of bad press that the SDP program needs. I understand it can be a little onerous or even just a little frustrating and say, well, I don't want to. It's a personal issue, but it's also a program integrity issue for everyone on the phone. We do not want horror stories coming out of SDP that would make Medicaid or any administrator say, eek, this model is unregulated. And there have been horror stories nationally, and I just think we all owe it to ourselves to run it like that. But that's my take.
I agree with you, Mark. I'll just add a couple things and one point of clarification. The clarification is on the background check. If somebody is transitioning from one FMS to another FMS, and they had their background check completed at the previous one, the DDS is able to do a background check essentially and confirm that they're already background checked in their system and give the new FMS their blessing that this person's background has been cleared. So they can avoid the life scan part of it if they are in the DDS system and active and there hasn't been a gap and all of that. The caveat to that is sometimes families think they're in the DDS system or their employee is, but it turns out they're not because they work for a respite agency, not another FMS. And they went through the same process of getting the life scan and all those things, but the results weren't sent to the DDS. So it has to be background checked and cleared through the DDS, but it doesn't necessarily mean that they need to have the actual life scan done if they're going straight from one FMS to another one. That was a pleasant surprise for me to learn, and clients are happy to know that at least they don't have to do that. We're a little bit more flexible on the sole employer. If it's a household member and the family does not want to do a background check, then we won't insist on it. They live in the same household, they have access to that individual outside of their work hours anyway. So as the employer record, we allow them that kind of autonomy to make that decision. If it's a stranger they're hiring, we do insist on one. They may not legally have to do one, but it's the right thing to do, and I don't have to be part of it. They're welcome. And we hear this all the time. Other FMSs do this or do that, they allow this. And that's why you have choices. But as a parent myself, I could not live with myself if I didn't do a background check on a complete stranger and something were to happen and I could have prevented it. We're not in this business just from a legal and financial standpoint. So yes, I may have no legal obligation to insist on that, but I think we also have a moral obligation to protect the regional center clients. Same thing with workers' comp. A lot of FMSs may be somewhat relaxed with checking whether or not the family has proper workers' comp insurance. If that employee gets hurt, there should be some insurance in place. So we insist on, if you want to do sole employer, that's great, we support it, but make sure you have the insurance, make sure you're doing the background checks, make sure you're doing your responsibilities. And if we're part of it, we're going to help you meet those responsibilities.
Mary Nahidi at 532 kind of reiterated the question. So DDS does the background check, ? So yes, that's what both of our esteemed speakers were saying. So in California, DDS is the one doing the background check. So that means that it would work for any FMS. But as they said, if they worked for a respite care agency, then and what that means when they are they call it the custodian of record, the person who gets that background check. If something happens with that person, so let's say I have my background check with DDS and I go and do something very naughty that I'm not supposed to do, DDS will be notified. But with it only goes with that check. So in other words, if you were this respite care worker over here and they had that background check and I did something very naughty, only that person would be notified. So that's why it needs to be done by DDS, because they need to be the ones that are notified if something new comes up on a check. So that's why we have to keep it in the DDS system. Now, it was actually kind of handy that DDS said they would be the one, not each of the FMSs. So now we don't have to redo them for every single FMS. So that was kind of a good thing that happened. And then there was a question of who pays for the background check. And that actually is not an FMS thing. That is part of the law. The law says the employees have to pay for their own background checks. So that's the FMSs don't have a choice in that matter. That was actually written into the law. So I've already kind of started jumping into the questions in the chat because they apply to what we were talking about, but I do want to invite people to raise your hand if you have questions, and we will start. There were so many questions in the chat. I'll start going through them and make sure we try to hit all of yours. I clicked on something and I lost my list. Hold on. Here it is. Give me 1 second. We keep a running list as we do it. So there it is. Okay. Oh, this is an interesting question. Ji-Soo Yu at 444 asked, do you have a preference which model works best? That's an interesting question.
No.
Mark, say co-employer, just for fun.
Right. Yeah.
I can actually answer that one. This is where independent facilitators come in very handy, because they are going to help look at your spending plan and look at your needs and help you determine not only what model is going to work best for you, but what FMS that they think is going to be a good choice. And they can help you go around and interview people. And, there are some FMSs that are better at some things than others. And so that's where there is not one model that's right for everybody. Just like self-determination may not be right for everybody. So we want to, Judy's going to kill me for saying that, but we want to make sure that people are with they're in the right model and they're with the right FMS. I always say when people are transitioning in, having the right independent facilitator is going to make the process much smoother, run better. And when you're in self-determination, having the right FMS is going to make the program run smoother and better for you. We had a question in there. Will you accept people transferring to your FMS from another one?
Yep. Now, preferably in sole employer, I'm not going to say it has to be like this. That's why you talk to every family individually. And to my earlier points, we want to talk early up in the process, if that's part of the thought process. For sole employer, it's best if you try to do it on a tax quarter. So you would want to come over in April, July, your quarter ends. And that's mainly for tax purposes. Could it be done mid-tax quarter? Yeah, as long as, PPL is working with pieces, if it's a trusted FMS like Peyman, yeah, we could negotiate a mid-quarter transfer, because I know he's doing his stuff right, but maybe not from every FMS around California right now. And then bill payers, no problem, of course. You don't have taxes entwined there. And then co-employer to sole employer can happen at any time as well, because there you're leaving let's say Walmart, for instance, so I won't name another FMS, but you're leaving because no one leaves ACEs once they're with Peyman, they're there forever. So you leave in a co-employer model. Well, Walmart was the employer, and now Christiana is going to be the employer. And so all your tax withholdings, filings are clean. So it's just the soul to soul. What a cool, sounds really cool, right? Soul to soul on quarter ends.
Yeah, I think I would echo what Mark said. And Mark, it's not true. People do leave us. When they grow up and they're too big for us, we'll send them your way. So that is a natural progression of this. Um, I think the only thing I would say is even if it's possible, and even if your FMS is willing to accommodate you, it doesn't necessarily mean it's a good idea or a fun process to go through. A lot of times, for us, unless it's that sole employer to sole employer scenario Mark described, it's really not any different than a new client for us as an FMS. We get a new spending plan, we get a new authorization, we kind of run with it. But a lot of times they're trying to leave their old FMS because they don't have accurate monthly spending reports, their bills are not paid on time, or there's something that they're unhappy with. Well, if the bills aren't current and if the monthly spending reports aren't current, it's going to be very difficult to do that accounting and for the regional center to figure out where to kind of divide that spending plan and issue a new authorization for the one you're going to. So from an FMS standpoint, we fully support it. But I just tell the clients to set their expectations. It's not an easy process for all involved on the side that they're transitioning out of. So just kind of plan accordingly and set your expectations.
We know it is a challenging thing to do, definitely. Um, uh, Tommy at 505 asked, thank you for breaking down so clearly. She was talking about the employer burden. Do the rates go up if there are worker comp claims filed?
No.
That was an interesting question.
Because yeah, it's a great question. In if we were doing individual policies on an individual basis, maybe over time we would bump the percentage, but you work with, in this type of situation, you work with a broker that gives it's called an umbrella policy. And so you just keep adding employers under that umbrella policy, and it would take a whole lot of people filing a whole lot of claims to really start moving that percentage up for us. And it's not going to happen.
We're hoping that as we grow, it'll go down because we'll have better kind of negotiating power to be able to get the better rates. And also, once we commit to a client, we're committed for that spending plan year with us. So even if there are any changes to our rates, it would be for everybody that's coming in after that change. We're not going to change the burden rate for a client that's already with us mid-year and have them get surprised because they're probably already planned for their spending.
Oh, this is an interesting question too. Danita Custard asked at 511, is there a different rate for sole employer for a live-in provider?
We don't have a different rate.
No. And again, I'm just going to say nationally, I've never heard of a state giving a pay differential in one direction or another for live-ins. I've just never heard of it.
I'll tell you where it comes from. IHSS workers do not have to pay taxes. And so specific live-in providers, family members do not have to pay taxes. I don't think it would be a difference in the your employer burden rate. It would be what you're deducting because the taxes don't need to come out. So there is one in particular, two FMSs that have a lower rate because they're paying less in taxes, just in the case of a parent live-in provider.
There are live-in exemption taxes. There are difficulty of care tax exemptions that I'm not going to get into the gory details of, and I don't want to misspeak, but those things are true. But an outright pay differential, I've never heard of.
Oh, somebody had asked what happened to the other two FMSs. We apologize. They both actually had family emergencies. So they were hoping to be here. They both apologized profusely, and we will make sure to have them come at another time too. Um, uh, oh, this was also from Danita. Danita was full of good questions tonight. At 5:14 said, when you said I think this Peyman was you. When you said a facilitator as an employee, did you mean a parent can't be a provider?
The parent can be a provider as a vendor, not as my employee. They can't be on my payroll. That's the only restriction if they're going to be a facilitator.
Because they are, well, so I'll give the background of two reasons why. So one, independent facilitator would depend on the age of the person. You cannot be paid to be an independent facilitator for a minor. So there's that piece. You cannot be paid for multiple things. So they could only be billing as independent facilitator and couldn't then be doing other services. So they could, so when I have parents that ask, can I be paid as an independent facilitator? I'll often ask them, what are the things that you are doing? Is it only independent facilitation type work? Or are you doing other things? Are you driving them somewhere? Are you doing other things? In which case, it's better to be an employee because you can be paid for more different tasks that you're doing, depending on what code, service code you're under. When you're doing independent facilitator, all you're doing is independent facilitator work. So I think that's kind of the gist to that. Oh, Brandy Perkis asked at 5:30, do you require CPR first aid for respite worker and sole provider?
Meaning sole employer?
I would assume that she meant sole employer.
So I'm gonna admit honestly, I don't know if there is a policy, if there's a DDS policy around respite workers needing CPR and first aid. We're gonna follow the policy. That one I don't recall off the top of my head, so I'm gonna just honestly say I'm not sure on that one. Maybe Payman knows. Now,
I
as a
can answer.
co-employer,
I can
that's a
actually answer
different
the question.
story.
So if you are putting it under the service code for respite provider, they are required to have CPR and first aid. Sole employer, co-employer, it doesn't matter because it's a Title 17 requirement that respite workers have certain, that the Title 17 are the requirements that are the minimum requirements for specific people, what they have to have. So like an ABA therapist has to have a limited, a specific, and that's one of the things the financial management services are responsible for, ensuring that in the specific service codes, if somebody has a requirement like that, that they meet that requirement. So yes, under respite, which is why we always say, don't put it under respite. Put people under, a personal assistant. Respite has to happen in the house. They can't go anywhere. They can't even go to the mailbox. So I always question people, don't put respite in your spending plan because you're limiting what they can do. Put it as a personal assistant. They won't need the first aid. If your loved one would benefit from having their people trained in first aid and CPR, please do it. But it isn't a requirement then. So that.
I also want to just say that your 1915C Medicaid waiver that California filed with Medicaid is probably the biggest waiver I've ever seen in my life. I think it's almost 500 pages. But in your waiver, every single service for SDP is listed, and all of the requirements to provide that service are listed. And so someone in my position, I went through that entire waiver and created a big Excel spreadsheet with every service and every credential. And then I give it to my IT guys, and they code all of that into the system. And so when an employee is enrolling and they're authorized for a particular service, the system's prompting our staff to make sure all these credentials are on staff. Just so everyone knows out there, I'm not wheeling and dealing off my memory about what's required for certain services. That's why information technology systems are pretty great and pretty handy when you're administering this program.
I think you might have already answered this question, but Mary Nahidi of 458 asked how FMSs make their money. And you guys make it from the monthly administrative fee,
So we're
right?
making any money.
Well, we hope you are because we want you to stay around. Um,
Yeah, I do want to. I saw her question in there. She's actually had a number of really great questions. And two things. So, yes, DDS pays ACE or pays public partnerships a monthly rate that they set based on the number of workers or providers in your plan. And that is our company's revenue. What is not revenue, and what we should not be making additional money on through any hidden percentages, are the service dollars in that budget that are paid out to the workers or the agency providers. Mary had another good question in there about, and I do want to make sure we cover this. Does ACE and PPL get the individual's budget money in advance? No. So that's the big risk that an FMS takes, and that's why big budgets are more risky than lower budgets. The dollars that Peyman lays out and PPL lays out they're at-risk dollars. There is a chance we're not going to see them again. Why? E-billing system issues. Regional Center, for some reason, says this wasn't reimbursable. We're going to deny this part of your claim. So we are not sitting on, $180,000 budget and then not paying it out for this reason or that reason. You are absolutely advancing the money at risk and working very hard to make sure you've paid compliant and you get all your money back. If you don't, that's what's called bad debt. That's money lost. You're not getting it back.
and I think understanding that FMSs get paid in arrears also means that when you're putting something in your spending plan, make sure you have a very good, clear description of what you are getting, because that will make it much easier for them to know this is what's been, the regional center has looked at this. This is okay. It's a very clear description. This is what needs to be purchased. So if you don't have really clear descriptions, then there will be back and forth of I need to verify that this is okay to purchase, for that very reason, that they'll pay for it and they won't get reimbursed. Diane, you have your hand up. Oops, can you?
Can you hear me?
Yes, we can.
Can't see me, but can yeah, it's just a question. Thank you. And I know you answered something to it, but I was distracted. So if a parent is a worker of a young adult child, 25, 26, and that 25-year-old is living at home, can you mentioned something about the parent doesn't have to pay taxes on their income from this SDP? Did I hear that correctly or incorrectly?
You heard it correctly, but I will say that talk to your tax person. I am not a tax person. I am talking from my personal experience, which is I get paid for my son. He is an adult. I do not pay taxes on that. I don't pay taxes on the IHSS income that I get. So, but
Well, you don't pay taxes on the IHSS, or are we talking about the SDP or both?
or STP, both. So it's treated the same way on my taxes. But I encourage you to talk to your tax person, because I don't want you to just, I'm not going to have to pay taxes because Christiana said that,
Anyone
definitely.
else can speak to this, maybe with different experience, please shout out, including FMS speakers, and thank you. Nobody? Anybody?
I'll share from our standpoint. We get this question asked quite often, and it's really not a decision for us to make. If they choose to have check the box that they're exempt from withholdings and they don't want us to have withholding taxes taken out of their paycheck, then that's what we're going to respect and honor. So we also take the suggestion Christiana made of talk to your tax advisor. But there is something out there that allows you to take that exemption and not pay the withholdings. So it's definitely worth looking into.
During the enrollment, we talk about relationships, who's living where. We explain what the live-in exemption is, and we explain what the difficulty of care tax exclusion is. And then ultimately, we're relying on the information we're provided to make the decision whether live-in exemption applies or difficulty of care applies. And those two things are, again, those are Medicaid driven. SDP dollars are in part Medi-Cal. You get a federal match on every dollar that a state puts up for funding. And that's why California submitted this 1915C waiver I've talked about, because once you submit that and get approval, that means out of the federal Medicaid tax pool, California gets a match. And then once you're getting a match, you're definitely playing by Medicaid rules, which do have rules around live-in exemptions and difficulty of care. And they're both good rules. They're in recognition that people that are doing this incredibly meaningful work and co-locating, or if you meet the difficulty of care exemption, should get some sort of tax credit. This is the most valuable work probably being done in society right now, and some of the least valued work, sadly, by our country right now.
So we're getting close to the end, but I have a couple quick questions that I thought were great questions. Mary Nahidi at 549 said, how does overtime work with your FMS?
So I'll let Peyman go because he does co-employer.
Yeah, so on the sole employer, you essentially have different employers. So if you have someone who's working for two different clients and they're both sole employers, then in effect, they're working for two different employers. So there is no restriction on overtime. If we have an employee that's working with only one family or one regional center client, I should say, then we do allow them to work overtime if the family wants to let them work overtime. So if they work over 8 hours or 40 hours, they'll get their overtime pay. Now, if you have a client, if you have two clients utilizing the same employee, under the co-employer model, we do not allow overtime across both clients combined. Because what will happen is they work for one client for 6 hours on Monday, they work for a second client for 6 hours on Monday. They haven't worked overtime for either client, but in both instances, they are my employee, and I have to pay them for 12 hours at the overtime rate for the overtime portion. And there is no equitable way to assess whose budget I'm going to charge that to. So because of that, we have to avoid that scenario and not allow our employees under the co-employer model to work for more than one regional center client and go work overtime. They can work 4 hours for each one, totally fine. We'll accommodate that, but they can't go overtime if they're serving two of our clients.
So some of the FMSs will say they can't work for multiple employers. You're saying they can, they just can't go into overtime.
Right, and there's a good reason those FMSs take that position. because in most cases, it's an accounting nightmare and a technical impossibility to allow that to happen within your platform. We have the flexibility because we have a custom platform to be able to put rules that are able to prevent that scenario of the overtime happening across both clients. So I understand why they don't allow it because it's just a lot easier, frankly, to take the position that it just can't be allowed.
Mhm. So we're right at 6:01. Nina, I'm so sorry. I'm not
No
going to
worries
catch you. Thank you, Mark. Thank you, Peyman, so much for coming and being so patient and letting us ask you, just bombard you with all these questions. Thank you for coming to the state and coming back and working with the state. Peyman, thank you for both of you for all of your work. And if we get any further questions, I will shoot them your way.
Thank you. Thanks for having us.
Yeah, thank you.
We'll see everyone in 2 weeks. Bye.